Hi, my name is Carissa Woodruff, and I go to Columbus State University, and I'm doing a PowerPoint presentation on National Patient Safety Goals. So I have a PowerPoint here. Unfortunately, my system of where my computer is a little odd, so we have to do it off my laptop for my presentation, which is in the facility that I'm doing my preceptorship at. So the goal that I chose off the National Patient Safety Goal is improving the safety of using medication. The two main pieces that they mentioned at the Joint Commission was taking special attention to those that use anticoagulant medication, and also making sure that you have an accurate record of what medications your patient is taking, especially every single time that they go and see the doctor. So why is this goal important in anticoagulation therapy? So anticoagulation therapy basically, it's used to thin your blood. So you need to really pay attention to what your patient's INR status is and if they're in range of the goal that they're supposed to be in, because there's a possibility that they could bleed out if it's too out of range, or it could clot up if it's not in the range that you need it. So it's really important to educate your patients on getting regular INR labs drawn, and also educate them on what their medication is and why they're taking it. It has been found that patients are less likely to take their medication if they don't really quite understand why they're taking it and why they're taking it so often. And why is this an important goal in keeping up-to-date records on medications? So doctors are sometimes changing medications a lot for some patients, depending on their problem list. So keeping an up-to-date status on what the patient is taking, which includes supplements and any other herbal remedies of whatever kind they're taking, is important because sometimes those medications and supplements can interact with the medications that the doctor is prescribing. And then also, if the patient's having a problem and you have no idea what they have taken, then you might not know the antidote or how to help them or what might be even causing the problem. So it's important to ask your patients every single time that you see them what they're taking and make sure that it's accurate on the medication list that you have. So anticoagulation therapy, I did find an article that showed the importance of educating your patients on a regular basis, bringing them into the clinic and kind of going over the medication, going over why they're taking it and for how long they're going to be taking it, because not everyone has to take it for lifelong. So just making sure that you're really educating your patients well, and educating them on getting their INR labs drawn as well, and really telling them the importance of that. Next one. So preventing medication interactions in patients. So this article was really focusing on using patient-centered care and really putting an emphasis on listening to the patient and trying to educate them and help them in wherever they are. So kind of looking at their cultural aspects, their thoughts, their desires, how they perceive what their medication goals are going to be, and just kind of working with that, and also helping to educate them on what changes they might need to make as well. And then maintaining compliance with medication. So this is another problem with medication, is not all patients are compliant with taking medication on a regular basis. So, and not all the time, doctors can't always tell if their patients are compliant or not, because a patient may say, yes, I take my medication every day, even though they don't. So this article was just talking about trying to help people become compliant, and ways to educate patients, and also ways to help doctors find out more information about what their patients are taking and how often. And also telling patients to tell their doctor if they're taking any new medication or supplements as well. So maintaining compliance with medication continued. So this is a continuation of the last article. So recognize the patient's financial restraint too. So when doctors are ordering medication, you want to make sure that the patient is going to be able to afford the medication that you're trying to prescribe them, because that's really important, and that can also hinder patients from taking the medication if they can't afford it. Also, letting the patient know about the risk factors and side effects of the medication. A lot of patients, when they're taking anticoagulant medication, some patients don't even know that if they stop taking it, they could get a stroke. So it's important to really educate the patients on what could happen if they stop taking the medication without their doctor's approval, or if they just stop taking it suddenly or discontinue it altogether. So medications that are wrongfully prescribed to adults. So this article basically was talking about the elderly and how difficult it can be to prescribe new medication for them because they're so sensitive to medication. So you really have to be aware of all the possible side effects of the medication that you're prescribing as a doctor. And as a nurse, you need to really pay attention to the changes that you might see in adults, especially the elderly, when it comes to medication, because some adults, all of a sudden they get a cough or something, and they think it's because of their medication, so they're automatically going to stop taking it. So, and really don't want that unless, especially if the medication, if that's the only one that will work for them, even if it is a side effect, you really want them to continue to use it if it's going to save their life. So this is basically just making sure that you know what medications you're prescribing and making sure that it's safe for the patient and that the side effects aren't going to be too severe that they are going to go off of it. And that's the end of my slideshow. It is important that medication is taken seriously for safety reasons because patients are an important piece of the healthcare system. So it's important that patients are taken care of safely and know what they're taking. Thank you so much for listening.